it's very overwhelming, very confusing when you're in it. Symptoms of things like reflux and colic are they overlap with so many other things. And in fact, reflux colic really is a symptom in itself in many, many cases of something else. And so it doesn't take very long to feel like you're down a rabbit hole.
Welcome to the Baby Sleep Connection, a podcast that explores baby sleep and more through the lens of attachment and development. I'm your host, Heather Boyd. I'm a mom of 3, an occupational therapist, and a certified infant and family sleep specialist. If you are a tired parent who wants to support your baby's sleep holistically, keep listening as we delve into approaches that go well beyond the usual strategies of wake windows and bedtime routines. Your baby's sleep is connected with so much more. I am excited to introduce my guest today. It's Alice Lucken from the UK. She's an IBCLC who supports families with very unsettled babies. Alice, thank you so much for being here today.
Thank you for having me, Heather. An absolute pleasure to chat to you today.
Lovely. I'm looking forward to this. I would love you to start by introducing who you are and who you serve.
Thank you. Okay, so as Heather kindly said, I'm Alice Lucken, and you can find me at Baby et al. That's sort of where I hang out on Instagram. And as Heather said, I'm an international board-certified lactation consultant. I'm also a nurse. My background was in health visiting. So in the UK, that's a bit like a family nurse, I think, that you have over there. So I sort of working with families with babies under the age of 5 was predominantly what we did. And about 3 years ago, I just decided I needed a change after the pandemic. I think lots of us felt we had to try and do something a little bit differently. So sat my IBCLC exam, something I'd been hoping to do for ages and put off actually during the pandemic. I was due to sit it that pandemic year and then was redeployed, and just the thought of sitting an exam in amongst all of that was just too much. So left my health visiting role and sat my IBCLC exam. And now, as you said, I specialize in supporting families with unsettled babies, so babies struggling with reflux, colic, allergies. I had a baby that had awful reflux, and it just it really impacted my experience in parenting. And I feel that we don't always get the best support and advice as parents when our little ones are unsettled. And so, I'm really passionate about trying to help families feel more confident. How do you navigate life with an unsettled baby whilst trying to figure out, is there an infant feeding cause at the root of this? Is there something going on that we can fix? Or is this about trying to help manage what we've got, and what can we possibly do to just make things better for everybody?
Terrific. Well, and you know very well that I have said to you over and over again, I wish you were the one I found when I was dealing with our firstborn, who was also a very unsettled baby with really significant reflux. But it really was like a mystery, right? You know what you know after you find out. But when you're going through it, you need a bit more guidance than is often available. I hadn't realized that we started out relatively similar starts in terms of the home visiting piece. We have an infant development program in Canada, and so each region does home visits that way. But I think it would have looked a lot alike, supporting babies and young children under 5. So that's a neat piece to discover. Yeah, you were the person I wish I had known several years ago. I wonder, as an IBCLC, you've looked at the feeding piece as being at the real heart of a lot of the challenges with unsettled babies. I wonder if you could unpack that a little bit, Alice.
Yeah, sure. It absolutely is. I very, very often in these cases of babies that are really uncomfortable and unsettled, issues with reflux colic, there's something going on with infant feeding. And it's not always the whole picture, but it's nearly always part of the picture. And so we need to go right back to the beginning and look at what's going on for baby, what's going on for the family, and how can we identify what's causing what. It's very overwhelming, very confusing when you're in it. I think partly because symptoms of things like reflux and colic are they overlap with so many other things. And in fact, reflux colic really is a symptom in itself in many, many cases of something else. And so it doesn't take very long to feel like you're down a rabbit hole with lots of information, but none of it really making sense and none of it sort of being clear. And you think, well, we tried this and this didn't work. And it's really about sort of like stripping all of that away and getting the puzzle pieces in the right order. And we absolutely have to start with infant feeding. And I think that often, certainly here in the UK, and I suspect in many other places, there just isn't that skill or experience in identifying complex infant feeding issues. And so we jump to the conclusion of, oh, well, your baby's got reflux, so therefore it's acid that's causing that, or we'll treat it with medication. And that approach just treats the symptom. It doesn't look for the root cause. And so we have to understand those root causes to be able to address them in the right way. And if we can sort things and then optimize things with infant feeding, it's incredible actually just how often other things start to fall into place.
Hmm. I wonder when you talk about the symptoms, there's the screening that a physician may do, but what is it that parents might see in their babies that would help them say, stop and pause and look at this is a problem to be solved with the right kind of support? What would they see? I mean, I say this knowing that any parent of an unsettled baby is going to be like, ding, ding, ding. Yes, all of these. But
Yeah.
what are the primary ones that you see?
I think this is partly where it gets really tricky is because our expectations of normal baby behavior and what's not normal are very, very muddied. And so you can go and see someone and say, oh, my baby's crying for long periods of time. Well, what is a long period of time? And I think 2 minutes of a crying baby when you're a parent feels like a really long time. And so a lot of this is really subjective when we're trying to get a picture of what's going on. For you as a parent, this is really subjective. You may say, oh, my baby's really struggling with wind. And when we unpack that, it might be at certain times of the day your baby's struggling with wind, or it might be they're saying, oh, my baby just won't sleep. And when we unpack that, actually some of these things might be normal baby behavior. But it's about, I think, having the compassion and the understanding as a practitioner to help you, the parent, understand what is normal and understand what's not normal, but also be able to listen to that gut instinct. Because I think we're dismissed a lot as a parent, especially if you're a first time parent. You will often get that, oh yes, this is normal baby behavior. Are you a first time parent? As if that then explains everything, that you just don't get it. And certainly there is an element of it being a real roller coaster, isn't it, when you first become a parent and not having a clue of what's normal and not. But I also think it requires us to support you to improve things where we can, understand and accept what we have to in terms of what is normal for babies and what's going on, especially in that fourth trimester. But also then say, okay, what can we address and what can we improve? What is normal and what can we support you with to cope when your baby's unsettled? I mean, in terms of like unsettled behavior that I see, it will be things like, so reflux, spitting up, colic, which is just a description for an unsettled baby, really is. And often you'll go and somebody will say, oh yeah, it's colic, as if that then just solves everything. Oh, it's colic, fine, that it's this. But actually colic isn't a diagnosis, it's just a description of a baby crying for long periods of time when we can't work out what the root cause of it is. Other unsettled behavior we see, so fussiness during feeding, unsettled behavior during feeding, maybe sleep disturbances, just unhappy, uncomfortable babies crying long periods of time. And these things can mean lots of things. It can be many different things that are going on for babies that could be causing these symptoms, which was what makes it so hard as a parent to understand what's going on.
It's something you said a little bit ago really hit the nail on the head for me as a first time parent, because both of us have a professional background that gives
Mm,
us a little more apparent knowledge and perspective on what is normal, what to look for when there is a challenge. And yet, when you are in it, it is
mm,
so hard to see out. And the dismissal is pretty common. I still remember when my physician, when I was at the breaking point with how poorly my baby was sleeping. And he said, oh, you're just going to have to decide if you're crying it out or not. And then he left. And I thought, I'm a parent that has more than average knowledge. I still can't figure this out. And now I've been dismissed and I don't know where to go
mm,
next.
mm. There are so
So,
many compounding factors there as well. I think that you're usually and for most parents, you're exhausted. You're absolutely exhausted for coping with an unsettled baby and lack of sleep. And so the ability to think things through clearly sort of leaves you, it leaves you a bit. And also you're massively emotionally involved. We don't, our brains aren't functioning in the same way. You're being pushed into that other side of your brain to be in so your nervous system's in tune with your baby. And so that makes us feel very out of control and very unsure about, well, how do I approach this? Because what your body's trying to do is make you listen to your instincts and tune into your baby and follow what feels natural. But we live in a world that's kind of drowned out all of those instincts and makes us kind of like overpower those things that our body's trying to tell us, because we've just got to get on. And when you can't function properly in the way you expect to, it absolutely adds to the overwhelm and not being able to think things through clearly.
And being unable to think things through clearly can be a barrier to reaching out for the support that could actually give you
Yeah.
the move those pieces around. I'm curious from your perspective, if you looked at what the barriers that prevent parents from reaching out and saying, yes, I need support and I'm going to pick up the phone to call you. What are those barriers for families?
Oh, multiple and obviously different ones for different people. I think the fear of being judged, I think, is probably huge. So as a parent, if you say to somebody, I'm struggling, it's like you're standing there saying, hello, I'm a bad parent. So and nobody wants to say that out loud. And that is absolutely not what it means, but that is absolutely what you feel. You feel, I can't help my baby. I can't understand what's going on for my baby. I haven't been able to fix this myself. Especially when you've got a baby that's crying for long periods of time, you feel like a failure as a parent. So that fear of being judged by your peers, by professionals, is really real. I think what else stops us reaching out for support? I think a little bit that sometimes we are told, and in some cases, this is normal, it's normal baby behavior, you're just struggling. So therefore we think, well, I just have to wait this out. And that's certainly what I did in my situation. We were told, oh, babies get a bit of reflux, he's gaining weight, it's normal. Never once did I actually think this was normal, but I interpreted that as this, there's nothing I can do about this. This is the baby I got. Some babies are like this, therefore we just have to wait for it to get better. And so that put me very much in a situation where I thought, right, there's nothing else I can do. I just have to lump it and get on with it and wait and hope that it'll get better. So I think there's a little bit of that going on, that we think, well, maybe tomorrow or maybe next week. And because babies change all the time, one week does not look the same as the next week. I think we've always got a little bit of internal hope that, well, I'll just wait and maybe next week things will be better. And then sometimes we can stop and look back and think, oh my goodness, I've been struggling with this for a month, for 2 months, when actually we might have been able to get you some support much quicker and make things much better for everybody sooner if we'd been able to get in there and give you some help.
Absolutely, absolutely. And I think of those barriers that you were talking about, the judgment being huge. And parents are vulnerable partly because of the sleep deprivation, but also because it feels very vulnerable to open up, as you say, and
Mm,
share the story without that overriding feeling of judgment. Because there is a lot of self-doubt. There's a
mm,
lot of self-doubt around whether we're seeing what we're seeing, whether we're interpreting what we're seeing right. And I'll be honest, as much as my professional background is an asset in a lot of ways, I do think that I thought to myself, well, I'm not going to be that kind of first time parent that is alarmist and worried about everything. I know that I can put this in the this is a normal spectrum of behavior box. And I do think on some level that got in my way of reaching out, in the same way that perhaps a parent that doesn't have a professional background may have at least that one layer that isn't there.
mm.
Now, you didn't use the word shame, but I feel like that could be an appropriate word for the feelings that come up around thinking that if we can't handle this or do this as a parent, that somehow, those feelings of shame around not having a situation that is what we pictured when we first thought of becoming a parent, or that others around us have in terms of a less unsettled baby among our peer group. When I think about too, by the time parents find you, there's something that has brought them to a point where they can override those feelings of worry about judgment or shame or self-doubt, perhaps because it's at a level of like desperation, like
Mm.
we've hit this wall. What do you see among parents who have gotten to that point where they're like, okay, yes, I will finally book that call or I'll make that appointment so that I can find some way out of this challenge?
Mm, mm. I think you're so right there. I just it made me think. I've just been to see a family today, not with an unsettled baby, a new baby. It was an infant feeding visit, and I said to them, "Oh, what's going on? How are things?" And they said, "Actually, we think everything's okay, but we really want to do this and get it right. So we just thought we'd get some help now." And this baby's only 6 days old, and I just was like, "Oh my goodness, I love a visit like this because actually it was all. I mean, it was the majority of the support that I do is all about empowering your confidence as a parent. It's all about helping you understand your baby, see what's going on, and then put you back in the driving seat of being able to make the decisions that are right for you. The infant feeding is key, absolutely, but the confidence building, the empowering you is huge in every bit of work that I do. But I just thought this is a great opportunity. Things aren't awful. They're not completely overwhelmed, distressed, in pain, struggling with feeding so much that it's all going wrong. And so we could work in a way that just empowered them and gave them confidence to know what to look for that might not be right and to how to keep going. And I think, yeah, for many of the parents that then come to me with unsettled babies, they're coming quite late because we often try and fix it ourselves or ask other people that maybe mean well have well meaning. They want to help, they'll give you advice, but if they haven't got the skills or the experience, and because it's so individual, like what might have worked for them is not necessarily what's going on in your situation, we end up trying lots of different things, and then I think you get to the point where you are just completely overwhelmed and confused by all the conflicting information you've been given, that often I think you're then right, now what have I got left? And that's the difficulty, is that we could definitely do so much more before we get to that point, so that you don't feel so overwhelmed and conflicted. Yeah, so it's tricky because, yeah, for many families we're trying to sort it ourselves for all of those reasons that we just said, because we want to be able to do it, we want to be a good parent, and then, yeah, we just leave it too late, really.
That brings to mind the challenge when we have, as a parent, others around us who have figured out or solved their challenge. And the temptation for those other parents is to say, try this. This is
Yeah.
what, like, this is the missing piece, versus your perspective as someone who sees many families with unsettled babies, to
Mm-hmm.
know that there may be some particular situations that are more likely to be the missing piece, but to have that spectrum of experience to say, I know where this is likely to fit in, so we have a place to start, rather than a single track. As you say,
Yeah.
every family is different.
And I guess, as a mother myself, and as if we look at society, that layer of support is really important, that peer-to-peer support, and that passing of skills on down through the generations. And I guess that, we sometimes the difficulty here is the bad bits come as well as the good bits. And so we get advice that's out of date, not backed by evidence, and it can lead us down a way that's more confusing. But there will be cases, I suppose, where you're trying something and somebody says, try this, oh my goodness, and it works a miracle. And so I think that as human beings, we're naturally going to gravitate to the things that we think, oh, that'll be a quick fix, so let me try this because it might work, and then it doesn't work, but somebody says, oh, swap the milk or stop breastfeeding, and we think, oh well, I'll try this and I'll try this, and that's what then leads to the confusion and the overwhelm when it's not working. And sometimes we then potentially are making decisions around things without all the information that we might need. We can often end up maybe stopping breastfeeding because somebody had suggested it was better, we felt that was our only choice, when actually maybe it wouldn't have been needed if you'd had the right evidence, the right bit of information to inform your decision. You may have still made that decision, but if you had all of the facts, you wouldn't maybe regret it in the same way as if you made a decision without that information. And so, yeah, there's definitely a layer that's really important of that kind of support. But yeah, I guess it's about the point of thinking, okay, we've tried this, things still don't feel great, I'm feeling a bit confused and overwhelmed, now I need to get some skilled support with this. And I guess the other thing that comes there is we often then reach out to a health professional. So you might reach out to your family health nurse or your pediatrician. And unfortunately, sometimes if they're not overly skilled in things like infant feeding, you might still get confusing or conflicting information. So you feel like you have reached out to the support, but you haven't necessarily got the right support that you need. And that's hard to question. I'm not saying that other professionals are bad, because they're not. There are many, many amazing professionals out there that do so much for families. But just sometimes, certainly here in the UK, when it comes to infant feeding, there's a lack of skill and experience and knowledge around infant feeding, and so it just doesn't even get considered as being a factor in this, and so there's a big puzzle piece missing then.
Absolutely. No, I love how you put that. I wonder because, well, and I guess that's where the empowerment piece comes in too. Because if you have the confidence that you can navigate this and get the right support, then any of the advice or ideas that come to you, you'll be able to take them in a different way than if you're feeling like you do not have the capacity to find the
Mm,
answer. So
yeah.
I guess that the word that comes up to mind is the word hope. That hope,
Yeah.
to have hope that there is a path through and that your path may be different than any other parent, but that there may be some similarities in what you can borrow or apply or pursue based on what else you're hearing from others.
Yeah, absolutely. Absolutely. And your journey's going to look different to other people. And sometimes it can be solved quite quickly. Sometimes there's multiple things going on and it takes time to address some of these things. Sometimes we want things to be sorted, but actually we're gonna have to wait. We're gonna have to work on this, and it's going to take time to improve before this then improves. So yeah, it's about I think it's about as much as looking for the answer, is how do we navigate you along that journey on the way to the answer, because it does take time. So how can we support you to parent in the way you want to whilst we're trying to get there?
Well, I always think about the analogy of a sailboat with parents when we're trying to navigate through. And I
Mm,
think that idea of sometimes it takes time and it can feel so difficult to have the patience. But
mm,
when you're in a boat, the first step is to point the boat in the right direction. And you may look behind you and say, we haven't gone anywhere yet. But okay, we're pointing in the right direction, and that's the very first step. Then we can push offshore and see where we go.
and parenting's a bit like that. I think when you're in it, every day feels really long. When you're not getting much sleep and your baby is unsettled, 24 hours is a really, really long time. But sometimes then you look back and think, oh, okay, well, where were we last week and where were we the week before that? It's amazing to see the changes in your baby. They change so much in that first 6 months of life. They've got such a huge amount of growing and developing that's going on for them, and adapting to the world. It's just a huge period of adjustment time for everybody, that it that yeah, we want to be in a better place with a bit more sleep and a happy settled baby, and it just doesn't feel like it's happening quick enough. And then sometimes you stop and think, oh yeah, okay, hang on a minute, this day has been a bit better. And I guess sometimes it is just about taking it a day at a time when you're trying to survive when things are tricky, and sometimes that's what it looks like a little bit, and other times we might be able to help you get towards thinking, okay, yeah, we're definitely on the right road here. It's hard, it's so hard.
It is, and for so many reasons, it's hard.
Mm,
And when you know that you can take it day by day and kind of zoom out to see that you're making progress that may not be visible when you're zoomed right into the
mm,
hour by hour ticking clock of the long 24-hour
yeah.
period, because it certainly does feel long. I wonder, Alice, if you could speak to the role that medication tends to play, because there is a tendency to have medication, at least traditionally, be the first line of defense. It has a place when you are looking at solving the underlying root cause of unsettled babies. Where do you find medication falls into that? when you're able to address the other aspects of it?
I mean, that's a great question and a really political hot potato, isn't it? Because I think the way it's treated in Canada is probably very similar to the way it is here. That, as you said, it's often the first line. You know, you go to your doctor and you say that my baby's unsettled, or my baby's spitting up, or they're not sleeping, you know, for long. And because the symptoms are so broad, I think they're often then straight away it clicks at, oh, reflux, colic. This is what's going on. And I think we've become quite conditioned that when we go and see our doctor, I mean, certainly here in the UK, our system's probably quite different to yours. We don't pay to go and see the doctor, but you'll get a 10-minute, maybe 15-minute appointment with the doctor. They're extremely busy, extremely overworked. They're exceptionally knowledgeable professionals, but like I said, they have very little infant feeding training, an hour, if that, even sometimes. And so they want to help, but they want to help you. So they'll hear that, they'll hear these symptoms. And so they want to be able to give you something to go away with, to feel like you've had this positive experience and something might work. But the problem here is that often the medication is treating the symptom, not the root cause. So it might improve things, it might make no difference whatsoever. And there's actually very limited good quality evidence about the effectiveness of any reflux medications. But because it's sort of just been the accepted approach, and because in some cases it seems to help, that's what happens. But I often find there's not a full discussion with the family about the risks, the benefits, the possible side effects. What are the alternatives? So what else could we try? What would happen if we did nothing? There's not this great sort of huge discussion that involves the parents about, is this the right decision or not? It's like, oh, okay, these symptoms sound like reflux, go try this medication and come back. And that's so many factors in that. It's time, it's knowledge, it's skill, it's, yeah, money often, you know, there's so many things involved in that. You're right, there is a place for some of these medications, but that's generally for babies that are diagnosed with gastroesophageal reflux disease, where we think, and I'll say here again, the evidence isn't great that it's acid that's causing these babies pain, but if the acid is damaging the esophagus, then we can't allow that to continue. And so the reduction of the acid can then stop that damage happening. So there is a role in it for babies with that. The difficulty comes in getting the right diagnosis. And many babies are being treated as if they have gastroesophageal reflux disease, when actually it's either physiological reflux, so gastroesophageal reflux, that can be managed by how we feed, how we care for our babies, or there's an underlying root cause that's making this behave in a way that displays a little like gastroesophageal reflux disease. And again, we can identify that and improve things. And so I think there's a big step missing in terms of, okay, let's go right back to the beginning. Let's work out, like, you know, how are we feeding, how are we caring for our baby, how are we responding to our babies, and looking for, is there a root cause going on? And that's because you can't do that in a 10 or 15-minute appointment. You just physically can't. So yeah, some really big missing steps that then means parents are sort of all pushed into this bracket of we'll treat it with medication.
Right, right. When you say gastroesophageal reflux disease or GERD, I think the actual diagnosis requires a bit more of an involved or invasive look at things. And that doesn't happen very, I
No.
mean, it did happen a lot in my clinic when I was working with preemies in the hospital, but it's more involved than just looking at symptoms. So
Yeah, I mean, the difficulty is that often that's how it's the clinical symptoms is the start of that. I mean, technically there are different symptoms. So a baby with gastroesophageal reflux disease, you know, is crying for really long periods of time. They're in significant amounts of pain. They're unable to lie flat. They are often faltering with their weight. They might have some feeding issues. They've got a hoarse voice because their, you know, their throat potentially is sore. They might have a cough, a persistent cough, respiratory infections. Now, they don't have to have all of those things to tick that for being the diagnosis criteria. But what often happens is, I think that, and I can't speak, I am not a doctor, so I'm not making these diagnoses, but I think what happens here is, oh, spit up, unsettled baby crying long periods of time, and it's like it rings that bell of, oh, okay, this could be reflux disease, without actually maybe looking at some of these other symptoms present. And to get an accurate diagnosis would involve, like you said, a really invasive procedure, and we don't want to do that for babies. But I think in some ways it also then means babies that don't necessarily have that are being put into the bracket of it being reflux disease, as well as actually on the flip side, sometimes babies that potentially might have reflux disease being told, oh, a bit of spit up's normal, all babies get that, you know, it'll pass. And so we're doing a bit of an injustice to both families when we're giving them those kinds of advice.
Right, right. Well, and as you're talking about, the reality of those well baby visits or scheduled visits with doctors, and I do think we have a lot of similarities in healthcare between our two countries. And I think, gosh, wouldn't it serve, like this is my, imagining piece, wouldn't it serve families so beautifully to have a more collaborative
Mm.
approach where doctors knew that they could, and you're nodding and
Oh,
smiling.
just
Like,
it would
I
just be so beautiful.
see, and I think about what happens in rehab, like spinal cord rehab, where there are professionals talking with the patient and the family around the table, and they each have their area of expertise, but they're working together. I think even the physician at that table with years of experience knows that they have a particular set of skills and that everyone around the table can
Mm.
contribute. So, oh, we can imagine,
Yeah,
right?
it would be amazing. And I think it's just a shame that we don't have that kind of approach for families, because then they would feel more empowered. They would feel that they had, the time to talk about what's going on for them. We could delve deep into, okay, is this just a let's help you adjust to life with a newborn baby? Is this about, temperament and the start your baby had and how we care for your baby? Is this about how we're feeding? We could just do all of those pieces of work whilst there's somebody checking that it's not a significant medical issue going on. So many things that we could address that would just improve the experience, I guess, of being a parent if we had that kind of approach. Mm.
I wonder, Alice, if you had an idea of what you wish doctors were asking more often of families or of the situation that's presented.
Oh, that's a good question. I guess I mean, we do have the nice standards here in the UK, which are a set of clinical guidance to help direct doctors, mainly in this circumstances. I mean, all health professionals come under the nice guidance, but when they're looking at a baby with infant reflux, there are guidance around that. And one of the first things, actually, it isn't that it should be straight to medication. It should be to ask, has your baby had an infant feeding assessment? So if that was the first step, that would be great. Like, has your baby had an infant feeding assessment? The difficulty is, I think this is multi-layered, because it's not as straightforward as just saying, has your baby had an infant feeding assessment? Because they can say, yeah, somebody's seen my baby feed and said the latch looks great and it's fine. And it's not as straightforward as that, because the skill and the training is not all equal. And so, even with the best will, in the world, one health professional might have looked and thought that it's all fine, but actually they might be missing something that somebody with more skill in that area can correctly identify. So really, in an ideal world, I think, when these babies are presenting to a GP, I wish there was a way that said, we're going to refer you to an IBCLC. At that point, again, I think that there's always a place for the different layers of, like, infant feeding support. We have that peer support, the support from the midwifery team, a support from an infant feeding team at the hospital. But an international board certified lactation consultant is the gold standard when it comes to lactation support. And so before we give medication to babies, which is expensive, I mean, like, it's on the NHS. If that baby's going to be on prescribed a medication for the next 4 or 5 months, that is at some cost to the NHS. Wouldn't it just be great to say, right, we're going to get you a really good quality IBCLC who's going to have a really good look at feeding? Because, like, it makes me wonder how many of these babies could we find, oh yeah, there's a feeding issue going on here, sort it, and then those babies don't need any medication. So yeah, that would be a dream, really, I guess, is that they'd say, okay, let's have an infant feeding assessment first by somebody who's qualified and specialized in doing this. And then I guess, like you said, that collaborative care of saying, okay, what else do we need to address for the family here? Is this about supporting the family more so that they can cope? Is this about, do we need some body work from a professional where there's tension and tone for this baby that's impacting how they feed and how they feel? There are just many layers that would help support the family, I think, without before you necessarily had to go to medication.
Mm. Yes. Well, and when you mentioned NHS, that's the National Health Service,
Sorry,
which
yeah, the National
no,
Health
that's
Service.
okay. For those in Canada, or at least in Ontario, we would call that OHIP,
Okay.
or what would be covered. Just for those that are listening and
Mm.
wondering what NHS is. I hear it all the time, but I imagine some Ontario families don't. I'm curious about the prevalence that you see in tongue tie, because we know that that's a huge topic of conversation these days. Maybe too much to bite off in, no pun intended around feeding, to bite off in our conversation today. But any sense of how big of the puzzle piece is that, so that we can kind of, again, keep things into perspective around what role that might be playing, because that's certainly a common path, maybe even second to medication in terms
Mm.
of the attention.
Yeah, that's a really great question. In yeah, in many cases, tongue tie can be an issue. Oral restriction absolutely impacts infant feeding. I think that, again, it's twofold. Sometimes it's not identified correctly. And so, a baby might be feeding, a mum might not be in any pain. You might be bottle feeding and everybody's saying, no, everything's fine, baby's gaining weight. And yet it takes a skilled eye to say, okay, this isn't effective feeding. And so this is leading to XYZ. I think that also on the flip side of that, we sometimes blame everything on it must be a tongue tie. And actually, there are so many other things that impact how well your baby feeds. I've mentioned, before, tone, tension makes a huge difference to how well babies feed. And it's not only about the tongue tie, it's about how do we support this dyad to feed well? How do we improve feeding whilst we're waiting for assessment, whilst we're waiting for things to get better? There's so much more you can do than just a tongue tie division. It's just one part of the puzzle. And certainly here in the UK, very often families might have an issue with feeding and be told, oh, it's probably a tongue tie, go and have a tongue tie division done, but don't seek any additional support around feeding. And so sometimes those feeding issues can continue because there's other things at play. Sometimes it's because a tongue tie isn't always a quick fix. There's other work that we need to do. And yes, sometimes it's not tongue tie at all that's causing those issues. So it definitely is or often in the mix when it comes to unsettled babies, reflux, colic, absolutely symptoms of a possible tongue tie. But I'm really, really pro of saying, okay, let's have a look at what's going on here. If we did XYZ, how are things now? If we did this, how are things now? Still not great, still got these issues. Okay, let's go and have a look from a practitioner who can correctly identify whether this is restricting and impacting feeding, and then make an informed decision about whether you want that to be divided. And then let's support you after a division to try and optimize feeding. Those muscles and how the tongue works is not going to just suddenly all start working straight away after you've had a little snip. So yeah, it's just bigger, much, much bigger than it just being a tongue tie.
It speaks again to that, and I know we haven't used the word holistic during this interview,
Mm,
but I know both of us practice in a very holistic way, and to look at this is one factor among many that need to be explored to put those pieces together and navigate through this.
mm.
Now, I had asked you earlier what you felt doctors should be asking. I'm going to rephrase that question for
Oh, okay.
parents. What do you wish that parents were asking?
Oh, that's a good question, Heather. I guess it's really tricky because I think as a parent, when you go and see your doctor, you are going there with the expectation that they are the expert in that room. So I'm going, I'm going to tell you all of what I see as a parent. This is what's going on for me. This is how my baby is behaving. This is the things that we're struggling with. And you're sort of waiting for their expert opinion on it. But I guess that what's really important here, and I guess I wish more parents knew, is that you are an expert in that room too. And that actually you have got way more knowledge and understanding about your baby that than that professional has. He or she might have that understanding, that medical knowledge, but they don't have that emotional understanding of your baby. And I think we doubt ourselves as parents, especially first time new parents. We don't understand what those cues mean. We're just learning. So we sort of expect everybody else to have the answers and you to have no answers. And yet actually there are more answers within you than you know. So I guess the thing about asking the what you would ask your doctor is, what's your gut telling you? So what does your gut tell you that you think is going on here? And ask about things like, what are the risks? What are the benefits? What are the side effects? What else could we do? What other kinds of support are available to us? What happens if we chose to do nothing? I think it's really about asking all of the questions to help you make informed choices. And it's tricky. I think we go there and just expect them to tell us what to do, and we'll nod and say yes and do that. So I guess that what I would say for parents is, go there knowing that you're on a more equal footing than you realize. What does your gut tell you? If you really feel something's not right, don't be dismissed. Ask for more support. And if that's not the right person to give it to you, then you've got to find somebody else.
I'm really grateful for that answer, Alice. That really encompasses a lot. I have one more question for you. It is there something that you feel is not being talked about in the field of infant feeding and settled babies that you think should be more part of the conversation?
Oh, that's a great question. Yeah, I think that it's about normalizing things. And I think that we've gone down two wrong paths. I think we're either on a path where we're telling all parents, this is all normal baby behavior, all babies spit up, all babies cry, all babies get wind. You need to just man up and get on with it as parents. Or we're down a path where we're medicalizing everything, where we're saying all reflux shouldn't happen, we need to treat it with medication, this is abnormal, this is abnormal. And actually neither of those things on their own are quite right. It's about the fact that, yeah, sometimes babies spit up. We might be able to improve that with feeding. We might be able to improve that with how we care for your baby. But some posseting, some spit up, some babies, babies cry, babies do cry, babies get trapped wind, babies get unsettled, babies don't sleep very well. Some of those things are really normal. But it's also about helping you to understand at what point it crosses over from being normal into, okay, this isn't normal, and what are our options to help support families to identify what's going on. And so I guess really it is about sort of shouting out that how we feed, how we care for our baby can make a real difference. Sometimes it's normal, sometimes it's not, but you might need some help to help you identify which and what is going on for your baby.
Lovely, beautiful. I said that was my last question, but the last one is much more about how you practice. This is one more question. Where can people find you? And I know you mentioned your Instagram, and maybe tell us just a bit about the program that you're running for parents of unsettled babies.
Sure. So you can find me at Baby et al. So that's baby and then ETAL UK. Baby et al. UK on Instagram is generally my main hangout. I have a Facebook page as well, but generally Instagram is where I post most of my social media content, or my website, babyetal.co.uk, where I've got lots of information about my services and things on there. And I have a blog on there with some useful articles and things. And then, yeah, the main way I support families is through my Route to Calm program, which is an online program for families with unsettled babies, where it's sort of online module content that you work through to help you get that understanding of what is normal and what's not normal, and get those puzzle pieces all in the right order to get rid of that overwhelm and help you get some clarity of what's going on for your baby, but also completely help raise your confidence as a parent and empower you to parent in the way that you want to. There's a lot of, as you said, it's a holistic approach. So there's support in there from a craniosacral therapist, a pediatric dietitian. There's a whole module on like a normal sleep and how we can set some really good foundations by a holistic sleep consultant. And there's lots of sort of bonus material from other wellbeing practitioners to help support you on the journey. And then what makes it so different is there's weekly coaching. So it's not just online that you work at your own pace and then you've got nobody to bounce anything off. You can come every single week and ask me, this is what's going on for us, where do we go next? And I can support you each step of the way to help you map out what's going on and get you a happier, more settled baby and get you some enjoyment back in being a parent.
I like that you finished off with the word enjoyment, because that does get to feel like a very, very far away goal for parents of unsettled babies.
Oh, yeah.
Thank you so much, Alice, for spending some time with me today. This has been wonderful to get to hear more about your approach and to get to spend some time with you.
Oh, thank you, Heather. I hope that's really helpful to some people that have might got a really unsettled one out there. So thank you so much for having me.
I have no doubt it's going to be of help. Bye for now.
Bye.
Thank you for joining me on this episode. I do hope that you found the information and perspectives in this podcast episode helpful to you as you navigate your baby's sleep development. Of course, this podcast provides general information and it isn't tailored to your family's reality or the specific needs of your baby. If you're concerned about your baby's sleep or health, be sure to reach out to your healthcare provider. If you're feeling exhausted and overwhelmed and you need a place to feel nurtured and reassured, you can find me on Instagram at familysleep.ca. Until next episode, look for the connections that support you and your baby.